out full as far as you can. Good. And one more. Excellent. And we'll do a couple on the other side.
76-year-old Beth Gibson knows the importance of exercise. It's a lesson she learned the hard way. Earlier this year, something happened that turned the active senior into someone who was homebound and reliant on the help of others.
Can we do that again?
It was a Friday evening. Went to the Roxy Theatre, and we were on the opposite side of the theatre to what our seats were. So I was walking along with my daughter across the back row, and it was quite dark because the lighting doesn't come in very well. And I didn't notice the wheelchair ramp in the middle of the back row, and I tripped over it. I thought I'd sprained my ankle, but by the next day I knew it was more than just a sprain, so I was to emerge and had an x-ray, and yes, it was broken.
Sadly, Beth is not alone. Statistics show that 1 in 3 seniors over the age of 65 will fall at least once a year. What's more, falls are the leading cause of injury-related hospitalization amongst older adults in Ontario, and 40% of long-term care home admissions occur as a result of falls. In Grey Bruce alone, the numbers are alarming. Here, the hospitalization rate for older adults injured during a fall is 35% higher than the rest of the province.
It affects all of our society, and it's starting with the person who suffers the fall and the pain and the suffering, but then those that have to pick them up and look after them and spend time in emerge, the cost to our healthcare system to investigate, diagnose, fix, and then rehabilitate. If we could avoid that, it's a huge savings to our healthcare system. Plus, it's a huge savings in pain and suffering of our elderly people.
My daughter, who was ill at the time, was trying to look after keeping me in food, either grocery-wise or bringing me things. My sister, who lives 45 minutes away, this is February, and she was coming through storms to help get me to appointments or cleaning for me, whatever. And I had a friend in the building. Between all these people and the support worker that came to give me a sponge bath, to have my commode emptied every day. Most embarrassing to have your friends and people not associated with the healthcare systems.
Stories like Beth's are the motivation behind the Grey Bruce Falls Prevention and Intervention Program, which is funded by the South West LHIN. The program encompasses several initiatives aimed at preventing seniors from having a fall and making sure those like Beth who have fallen never fall again.
And how long have you had symptoms for?
A week.
A week? Are you coughing anything up?
Yeah, there's this.
This woman has come to the emergency department in Markdale with flu-like symptoms, but thanks to a new screening program, her assessment will dig a little deeper. As soon as the software recognizes the patient is 75 years or older, the triage nurse is prompted to ask a series of questions to identify if he or she is at risk of having a fall. If the answer to 3 or more questions is yes, the patient will automatically be referred to the CCAC for a falls assessment with the client's consent.
Now, we have a new part that I have to ask you, and it's about fall risk assessment. It's pretty easy to go through. Now, you live at home. You're not in a
Yes, I live at home.
And have you ever fallen at home? No? And have you ever experienced a near fall?
Well, I fell years and years ago with my
But
son,
not,
so I'm not
recently.
No.
You haven't reported, of course, in any falls.
No.
And so you haven't sought any medical attention
No.
because you haven't fallen and you haven't broken a bone.
No.
So the reason we do this, if you answered yes to 3, then CCAC would call you and come in and
Yes.
help you sort stuff out at home.
The program is currently in place at the Wyerton and Markdale sites and will soon be expanding to include the Southampton and Meaford sites. It's expected that within 1 year there will be a 3% referral rate to the CCAC. Nurse Susan Coleman is encouraged by the program. She and her staff know firsthand the damage a fall can do.
Well, you see people with fractured hips or ankles or arms, elbows, or they could fall and hit their head and have lacerations and have to be sutured or have a concussion. Anything really that if they land on the hard surface and they have brittle bones, they end up with fractures.
Coleman hopes the screen will also help with patients who don't always want to admit there is a problem.
When we see them coming in very often, on an admitted patient upstairs, we will ask them, have you had a fall, or how many falls have you had in the last few months, or how many trips to the emergency room? But you don't really know if they're being honest, but at least this way we know that they're here and we're asking them the questions down here and the referral's made. So, and then someone from the community is gonna make sure they're doing okay.
So, looking at his record here, it is giving us a reminder that we should do that.
Okay.
So, we'll just click on
The emergency room isn't the only place where intervention is being practiced. Here at the Owen Sound Family Health Team, nurse practitioners Sonia Bruin and Crystal Osborne are using electronic medical records to determine which patients are at highest risk for falls. And age isn't the only factor.
goes through things like medications, vision and hearing, osteoporosis, any high-risk medications like narcotics or sedating medications that might put someone at risk of a fall, or if they've had a fall in the past.
Mobility, so whether they're using a gait aid or not, often that could be a trigger even to do a falls risk assessment. Like Sonia was saying, vision, hearing, whether they live alone is also pretty important.
With multiple patients a day, all with a variety of needs, it's easy for risks to be overlooked. Bruin and Osborne say this tool is another way to make sure patients are getting the best care possible.
Because like Sonia was saying, like you often, you might be seeing the person, for example, 4 times a year for diabetes checkups, but you get so focused on, okay, have we done your A1C? Have you done your fasting blood sugar? Have we done your blood pressure, your waist circumference, weight? And then it's like, wait a minute, you're on like 16 medications and you actually do use a rollator, and wow, we maybe haven't looked at that in a while. So you kind of can lose focus a little bit. So to have the reminders can sort of just be a trigger. So it's nice.
Unlike most doctors, these frontline workers are in the home where many of the fall incidents happen. Since March of 2011, they have also been helping assess falls risks with the Community Referral EMS or CREMS program.
But basically, anytime you walk into someone's house, I always walk in, you look around, oh, that's not good. There's a rolly chair and they're using that instead of using their wheelchair to roll around the house, or they got mats all over the house. So you're just looking for those hazards which might cause people to fall or have further health issues, whether, even people, they're chronic alcohol abusers and stuff, right? Increased risk of falls and stuff. So you're just not looking just for environmental, you're just looking for the whole picture and you're trying to take that in. And one thing in our job we're trained in is never have your blinders on, right? Always looking at everything around. We're basically going in, we're assessing the patient. Sometimes it does take a little bit of talking to, is there any way we can help you? We have this program with CCAC where, I don't want to be in a nursing home. Everyone thinks they're going to go to the nursing home, but really stressing the whole point, we want people to stay at home as long as they can nowadays. And that seems to be a big selling feature I found, that it's not that we're putting them in a nursing home, it's we're getting them help so they can stay out of the nursing home. People that would never be transported to hospital before because they have a little tiny abrasion to their knee and their vitals are all fine and they don't want to go, those are the people that we're now getting into the system, which is helping to prevent that big fall, which is going to break a hip or break further major issues.
Using laptops right in the ambulance, paramedics are able to enter information about high-risk patients. That information goes right to the CCAC.
So then I would write, Mr. Jones is having problems falling, multiple falls a day. Patient doesn't want to go to the hospital, but does feel like he would be, beneficial for him to have an assessment done by CCAC, fall prevention, OTPT, nursing care, or PSW, etc. So then once we do that, we basically type in whatever we need to, and then when we send our form, it goes via electronics right to CCAC. So as soon as I'm done my paperwork, they've already got a copy via fax. And it involves everything from the actual call that we were on, what they needed help with.
Right now we're averaging probably about 7 referrals a month, and I would say majority, 70-80%, are having some sort of a follow-up or some assistance offered. So maybe even higher majority of them are actually are needing some care and are actually entered in.
Whether through the ER, the electronic medical records, or EMS, the client referrals come here to the CCAC where they are reviewed by a case manager.
Hello, Mrs. Jones. This is Darlene Turner, and I'm a case manager with the Community Care Access Center in Owen Sound. We've just received a referral from the emergency department at the hospital in Wyerton, and they've informed us that you've had a recent fall and would like us to follow up with you. We kind of talk about what their nature of their falls were, if they've had them previously, if it's something that is a pattern, or if it's something that's just happened, it's just an isolated incident. So we weed out that information by doing the questionnaire on our falls form, and from that then we can use our experience as case managers to understand what their nature of their falls is, kind of what they need for services.
Case managers like Turner make sure clients get connected with the kind of care they need.
Typically, if they're having a lot of falls, we would incorporate physiotherapy and occupational therapy right away. And quite often we'll get nursing involved as well to look at medications that they're having or something like that, because there could be some nursing involvement. If they're having fainting, blackout spells, they can give them some information around that. So, and that gets into our comprehensive falls assessment, which we then would have a community case manager go out and do more extensive referral, or a more extensive assessment, I guess you'd say, with the client, and see if there's more information that they can gather. Maybe it might need some personal support workers in to help them out of tubs and baths, and get some equipment in place so that they're not at risk to fall and have more injuries the next time. So.
Sorry, Pat. So I was just going to mention one other way that you can engage more muscle workout when you're doing that is put the weight through the heel of your hand as you're lowering yourself in and out. We tend to kind of use our fingers for...
These students are part of the Georgian College Owen Sound campus Personal Support Worker program. Today they're learning about the benefits of exercise to future clients who may be at risk of falling. The Home Support Exercise Program features 10 exercises that are designed to rebuild and maintain seniors' strength and balance and ultimately help them stay on their feet. The movements are functional, mirroring movements they need in everyday life, like opening doors, reaching up in cupboards, or simply getting up from a chair.
Prevention is so very important. What we've seen in the past is people who have exercises in their life, whether it's walking or part of a program, just develops the muscles and especially balance, so that if there is an incident, and we can all fall down so very easily, but if that actually happens, you probably gain some muscle power and have healthy joints, that you'll recover so very much quicker.
Graham Bruce is really unique. It's a very rural population that is supported heavily by its PSWs. A lot of our population is very isolated, so these individuals have a unique relationship with the clients and are able to relate to them in that way. I think that's one of the main parts about it. Some of the other pieces are we have a high seniors population, higher than the province, as well as we also have a high hospitalization rate for falls in our area. So a much needed program to really look at the preventative component of falls prevention.
Along with the exercise component, students learned about fall risk factors as well as how to identify those at risk. Students who completed the program are now certified in falls prevention and intervention. This is the first PSW course anywhere to offer that certification. The goal is that better education for frontline healthcare workers will further reduce falls among those at risk. So far, more than 200 clients have been referred to the Home Support Exercise Program. Participants like Beth are proof of how important exercise is to keep seniors mobile, confident, and in their homes.
In that one split second that I fell, it just turned my life upside down. And you can't imagine how it crimps your lifestyle. Because I'm one to be on the go all the time.